I'm of a certain age group, and I like debates. I like people. I want to hear different opinions, and I want to know why there are those different opinions. And then I'm the first to say I will change my mind. And just for example, I would have this time last year put all trans in the same group. Now, I absolutely firmly believe that my few trans friends that I have, when they say, no, we're men, we are homosexual transsexuals, they are completely different from AGPs. Don't ask me about how can you tell the difference if you're walking down the street, because that's an argument I just haven't got an answer to.
I know there's a whole thing, if you piss, you pass, right? But it's really more than that. It's just because statistics are real, right? And there is a male dominance in violence against women, sexual or other, right? And that's why we've had these spaces.
But I honestly think that the men that are like the man in, I call it a bloke in a nightie in the hospital I was in, they're the ones that are in the majority, unfortunately, who are taking advantage of the fact that you no longer need a psychiatrist to diagnose gender dysphoria. You know, why is it too far a stretch of the imagination that twofold? One, a man, let's face it, it's mainly men. A homosexual man could be either trying to escape his homosexuality because of pressure, or he's been, because there's someone that we know very well on here who has been put on hormones since they were a young teenager. So they can't really go back. They never really had the chance to make that decision as an adult. And they are bullied rotten on here. And so they come across as aggressive because they're standing up for themselves. But my point being, they are homosexual transsexuals. I think the problem is the word trans.
Can I just touch on something, G, before I forget?
Yeah, do.
Because you spoke about gender dysphoria, right? And this is where it all comes to head and we stop communicating, because if you're on the camp, you don't believe in the word gender, right? Because there's 7,200, I don't know how many, right? So if we say we don't believe in gender, you can't talk about gender dysphoria. And the book of mental disorders was changed at some point to include gender dysphoria. So if I reframe the word gender dysphoria into like some kind of extreme body dysmorphia, because it's really a unhappiness with your body, which just have to be focused on your sex and your secondary sex characteristics, that I do believe exists.
Yeah, just before I go to Word Rebel, I completely agree with you, but I do believe in genders, but there are only two. Word Rebel, hi, how are you?
Hi, G. Oh, nice to meet you. Nice. I can jump in a little bit to talk with you guys, because I was following this discussion a little bit because I was talking in other spaces on other topics and things were happening in Germany. But I kind of overheard some arguments in one space on this. Let us call it true trans, right? And the gender dysphoria stuff, but I didn't have time to respond to that. And now that I hear this, I, as a linguist, I really agree with what Omega just said. She kind of said most of what I wanted to answer. And I think when you see gender and sex as the same, the question is, why are there two different words for that? One of those questions is that, and the other one is there is a lot of conflation with what gender and sex is, because some people imagine gender as something cultural. Some people imagine there are multiple genders, and you can't really discuss it when they're kind of like synonyms, but they're not the same. And actually, for example, when you have law on gender, it is supposed to mean sex. And so I think it all comes down to actually the definitions. And this is the problem where we are at, because there are several things, for example, like safe spaces that should be sex segregated, and there should be law that is on sex and that is defining discrimination concerning sex, right? So when we have like gender dysphoria actually meaning sex dysphoria, then this is really really confusing.
Yeah, really well said. My thoughts on everything you've said are there's definite problem with wording. Wording, I think the word trans and the word gender being two great big thorns in everyone's side. I think the true trans, again, we say it, I'm sort of doing air quotes as I'm saying it, because it really is a poor phrase, but I think I definitely agree. I do believe wholeheartedly that there are people that are suffering, and they are completely distinctive from those who are sexually fantasizing. And also, it's not just hurting women and children, it's hurting those with sex dysphoria. Let's change it to sex dysphoria, who, quite honestly, I don't see anything wrong in someone who's very feminine and is much more comfortable living as a woman. And I've been pulled up on that quite often. What does living as a woman mean? What does living as a woman mean? Well, I think it's quite clear. It's if I were to say, well, I'm going to, live as a man, I would be dressing as a man, calling myself a male name, behaving as manly as I could. Kind-hearted, decent human beings owe it to anyone with a mental health condition to protect them as much as ourselves and our children from the cheaters. My views aren't just made up, they're coming directly from people that I've now been friends with for 6-7 months. And they're equally terrified. I didn't notice, sorry. Hi, Mary, by the way. I didn't know if was it Amiga or Word?
It was me.
It was really
Yeah,
Word.
thank you, Omega.
Thank you.
I won't be rambling for too long. I just want to say two things. One is, for example, when we still imagine, and I understand your position, and I just want to put forward several things to kind of think about, to turn them around, because as someone who's a linguist, I like to turn around words, and this helps me understand things, especially, for example, when I translate, what I do occasionally. And so, for example, to go back to this gender dysphoria thing, calling it sex dysphoria, for example, or calling it extreme body dysmorphia, as Omega said. For example, when you had any kind of body dysmorphia and you didn't like your body being, for example, a little bit chubbier or something like that, and you wanted to get rid of your body, no one would have approved of you getting rid of your body completely or something. No one would have approved of, for example, Omega told about her breasts getting reduced, and I have a similar problem, but I didn't get them reduced, and it's really difficult to get this in Germany, and it's good. And today I'm happy. I know what to do. I do get a kind of sports therapy for my back. And if there is an indication, I will get help, and people will kind of support me in my bad feelings. And it's not only just bad feelings because I don't want to identify with my breasts or something like that. But there are people who really feel bad about their bodies. They don't want to identify with how their body is sized, if they're a little bit more chubby, etc. And they can suffer from that. And I think it is really comparable. And I really applaud you for feeling that way and for having this empathy. But for example, when you don't kind of say it's okay, I affirm you wanting to get rid of your body, when you don't agree on that it should be said to those people, why do we agree on people getting rid of their sex or sex the body or parts of their body, right? So this is my problem, because my major problem in this is that it's a fiction, and it's been allowed into the thinking way back before anything of that has ever happened. And now I have rambled much longer because it's so difficult for me to express myself sometimes. But I hope you got...
Gosh, if that's you rambling, you speak, and honestly, you speak better English than many English. Just quickly before Amiga, I do believe, my mind's gone blank. Isn't that always the way? I absolutely do believe in dysphoria, body dysmorphia, what have you. I don't know whether to call it sex dysphoria or gender dysphoria because of the wording, but I do firmly believe, and like I said earlier, because there are so many mental health conditions, I don't find it a stretch to see why would these people put themselves through years of hormones. And also, they are, again, I'm repeating myself, I know, but they are in no way in denial of the sex they are. They merely don't want to hurt anyone. They don't want to... I've actually argued with a couple of them who have said, who are incredibly feminine. You wouldn't know if you'd pass them in the street. And I've said to them, they said, no, I'd have to go into a male ward. I'd have to, I'm a man. And I'd say, I'd actually want you on the women's ward, because I think you'd be a danger in the male ward.
I got involved because of this whole unraveling of society, but that does not mean that I don't recognize that there are people in the society who aren't happy with what they got.
I can understand what living as a woman means. That doesn't include periods, that doesn't include giving birth, that doesn't include... It means that they want to be... They live more feminine. I have got all the compassion in the world for people who definitely have a mental health disorder that makes them decide that they're more comfortable to live as a woman. And like I said, I always struggle to understand why others struggle to understand what that means. I mean, it's even been described as to wear women's skin, which is quite... That's not what they're trying to do. Some choose to have bottom surgery, should we call it? Some choose not to. Some are virgins. I think we need to find the compassion for the genuine, who I know the group I'm talking about are. We need to find the compassion for those that have, and I will say suffer because it's a disorder, suffer from the symptoms that make them feel the way they do.
But you're talking about two different things. You're talking about, like, emotionally how these people have suffered, and that's not in debate. What's in debate, what living as a woman actually means.
I think for the discussion's sake, we need to not worry about the words, because the wording it really needs working on. That's my best way of describing what I call... I won't even say true trans, because I don't like the term trans. I don't like true trans. You can't transition. I don't like that. They are biologically aware. They're not in denial of biology. So it's trying to find the right wording. So for argument's sake, what my wording I'm using, don't take it as my meaning behind it.
I know.
Or yeah.
These frames have been used to legally justify women losing their rights.
I can't get the message across, and that's not meaning to be rude. It's because Millie, Mary, myself, some other people have spent time with a group of trans who are homosexual, who hate half of what they have to live with. I wouldn't want them in a couple of them I can think of. I would not want them in a male ward in a hospital. So my point being is, again, it's being completely conflated with those who are self-IDing as the opposite sex.